What is your name?
Jacob.
What is your last name, Jacob?
Jenkins.
And what is your date of birth?
9/28/91.
And how old are you?
27.
Okay, and his medical record number is, and if they would have an ID band on, you compare it to the information that you have. All right, what's the next one?
Introduce yourself in the correct manner.
And I'm Kim, I'm one of the physician assistants. I always do it as I go in the room, so as long as you introduce yourself, I don't care if you do it as you walk in or as you start talking to the patient, but I usually get that part out of the way.
Maintains eye contact.
I maintain.
Yeah. Excuse yourself to perform adequate hand washing.
So I will, and you have to verbalize everything, and that's the part. I still have a hard time doing that part.
Okay. Identifies patient using name, date of birth, and hospital number. Did that, and then explains reason for visit.
All right, Jacob, tell me why you're here today.
I have a rash on my neck.
Okay. How long have you had the rash on your neck?
2 weeks.
Okay. And what's the next thing I do?
Okay. So then, inspection of skin. Gowns patient for close inspection. Uses natural or intense lighting when needed.
Do you think we can see it without taking all you
Yeah, I think
upper
so.
body clothing off?
Yep.
So, but if not, then you would gown the patient, drape the patient. Anytime you are taking clothes off, especially with women, and any of them, with men, anything below the waist, have somebody else in that room with you. I mean, it's not a good idea to be in there by yourself.
Okay. Look for increased pigmentation, loss of pigmentation, redness, pallor, cyanosis, or jaundice.
So where can I check for all of those?
Shake hands.
I can shake his hand. And then I can also, one of the things I have a tendency to do is I'll touch them, if they don't have long sleeves on, when I'm introducing myself, and then, is the skin warm and dry? Is it moist? You can almost get a capillary refill just from, touching, and because it'll go lighter and then come back to the normal skin color. He's not cyanotic in his nail beds. I don't see cyanosis around his lips.
So do we need to verbalize all of that that's on there?
Mm-hmm. And if you wanna find your own, I would call it a shortcut. As long as you're saying, I'm checking the skin for, and then, some of it you'll be able to just reel off your tongue real quick. Some of the other stuff, you'll have to actually think about what you're saying. But if you want to kind of use easier words or something, that's fine. As long as I know that that's what you're doing.
Actually gowning up as like actor patients?
Say what
Are
now?
we gonna actually gown up as actor patients, like should we, or
Not these.
for ours just say, oh, I'll let you put on a gown and then just
Yeah.
kinda like,
Just verbalize, if needed, the patient would be gowned and appropriately draped.
So check. So this is now palpation of the skin. So check moisture, check texture, check temperature, check mobility, and check turgor.
So you're saying like back of the hand, or back of the arm, back of the neck, a body part that's exposed, and since he said his rash is on his neck, then he's not gonna be completely undressed. But you can, like I said, you can get moisture, you can get temperature, you can get, dryness. What else was on there?
Mobility and
Mobility and turgor. All right. Sorry. The VA's calling again to tell me about my appointment on Monday. But just checking the mobility and the turgor. He's well hydrated because you're pinching up. If it stays and makes a tint, they are dehydrated, or we have another issue going on. Does that make sense?
Yep.
All right.
Okay, and then palpate any lesion, noting lesion type, location, and distribution.
And on Monday, there will be a sheet in here for the patient. So when y'all rotate amongst each other, And once the first person goes, you'll know, the patient will say, I've had this rash for 2 weeks, and then it'll give you the characteristics as far as whether it itches, it's blistered, but you'll have a picture of it too. But they'll be able to tell you, like, the itching, or if it started in one spot and then spread. So that will be in here, and then you'll have a nurse's triage note available at the station as well. And then you'll go probably back to the classroom to document, and then you'll give, because I've already got those printed off, and then you'll give those back to Miss Reeves.
So now, inspection / palpation of fingernails and toenails. Note color, cap refill, and any cyanosis. Note any lesions, pittings, lines, or deformities. Note shape or clubbing, and the angle between the proximal nail fold and the middle plate.
And that's not an easy thing to do, because you're really looking, but you should not have this nail that's poked straight up, or one that's bent way down and pulled out away from the nail bed. Like I said, you can check the capillary refill for the cyanosis, and at the same time you're touching, so you can get the moisture. And a lot of that you can knock out in one move, but if you're not verbalizing knocking it out in one move, I can't give you full credit for it. Does that make sense?
Do you normally wear gloves for that?
Mm-hmm. And I guess I'm afraid of rashes, because you never know if it's something, that you can get just from shaking hands with somebody. I mean, like scabies and things like that. It's easily transmissible. So
And then-
let's see.
Oh, and then inspecting the scalp is the last one.
Because like where it says notes color, cap refill, and any cyanosis, you can say, the skin is pink, warm, and dry. So we go color. We know it's not cyanotic because it is pink. It's warm to the touch, which it should be, and then it's dry, so there's no moisture. Where's the lesion part at? So notes any lesions. All right, Jacob, tell me what your lesion looks like.
It's salmon colored
Mm-hmm.
and oval.
And that would be called,
Harold's
patch.
and you see that with,
Interesting.
very good.
And then he's gonna get a Christmas tree.
And what?
Christmas tree after that.
Yes, the Christmas tree. But when you're looking at it, and sometimes with gloves on, it is hard to feel. But like I said, I wear gloves, and I watch some of these videos of people doing skin exams, and they don't, and it just makes my skin crawl. And I did ask, we do have enough gloves that they'll be available in each room. So, does anybody here wear like an extra large, like you've got to have it to get your hand in it?
Chris?
Okay. All right. So I'll make sure we have extra larges, so everybody else is a small, medium, or large. Chris, you have to bring your own gloves on.
All right.
All right, so do you have the rash anywhere else yet? Or is it
No.
just on your neck?
Mhm.
Okay. And does it itch?
Yeah.
Does it burn?
No.
No? Has anybody that you've been around had a rash like this?
Catherine?
You're infected. All right, so, but there'll be information like that for the patient to tell you what it looks like. But don't be afraid to, wherever it is on his neck, we'll say right here, to, rub your hand across it. Did y'all have to get a tape measure? Okay, because I'm trying to get some of the paper disposable throwaway ones, but don't throw them away, because the ones you'll have in here on Monday are mine. I just so happen to carry one with me every time I go to work, and I always put one down in my pocket, and when I get home I still have it. So if I've not used it, so I've got some, but I've got enough for each room, but just don't throw them away. Just give them back to Miss Reeves. But measure if there's anything that says, if it's a generalized rash all over, you're not gonna be able to measure that. But if there's specific characteristic lesions, measure it, so you'll know, is it greater than a centimeter, or greater than, or less than, 5 millimeters, something like that.
Are we measuring the paper?
No,
Like,
well, actually, no, I'll just go with what the patient's gonna tell you, that it's, a lesion about the size of a quarter or a nickel or a dime or whatever, and then, but I want you to get used to measuring. Have I told y'all the ID badge thing? Okay,
Mhm.
and you had questions.
If they're, whenever we go in and they say it's on their hand, would we say, well, if it was any other place, we'd go ahead and gown you? Like, do we need to say that we would gown if it was in a different area?
The way I would do it is, if needed, the patient would be gowned and appropriately draped at this time.
Okay.
And then that way, it closes that door, but you've addressed it, that it's not needed and none of the patients will have to be disrobed or anything on that day. So y'all can wear normal clothes. Alright, then what is next?
Then scalp.
Alright, the scalp.
Note the scaliness lumps inside.
So it's like, yep, the scaliness, lumps, bumps, any lesions. Can I touch your hair? So, with females, you just, especially with longer hair, you can just kind of pull it apart and look to see if there is anything. Touch it and see if there's any lumps, bumps, bruises. And you can also, when you get to the back of the neck, you can check to see if there's any posterior cervical lymphadenopathy. It's not on there, but when you're doing that, you're in the same area, so you can go ahead and do it then. And verbalizing all of this, it's a lot to have to try to remember each thing within those categories. As long as you hit the main category and you've hit most of those, like if you forget to do one thing within the palpation of the skin, I'm not going to hold it against you. I don't expect you to memorize that entire sheet, front and back, as far as everything you're doing. Now, if you completely forget a category, it's a different story. But like if you don't verbalize texture, I'll give it, it says 1 point, but if it was an abnormal thing, I'm sure that you would go, oh, and it's very rough or something. But when you're talking about the lesion, because it says palpate any lesion, you do need to definitely note the lesion type, whether it's my favorite word, maculopapular, or it's truly macular, truly papular. If it's bullous, if it's crested, the shape of it. At least one station, you probably won't be able to say the shape of something, but it'll have some very specific characteristics that should lead you down the path as to what it is. And it's not going to be stuff that you've never heard before, because between pathophysiology, ClinMed, and here, you've heard it at least once in each of those. So I can't give all of it away, but I did give the big one away. All right, what more questions do you have?
Well, we have to tell the patient right there what we think it is. Oh, I think you have.
That's how I've done it with cohort 4. This is what I think you have, and either, we need to do some lab work to say yay or nay and then reinforce what I think it is, or, let's treat this and see if it responds to treatment. But in the past, all of the students would turn away from the patient and tell the camera what they think it is. And so I want us to get in the habit of telling the patient what we think it is and how we're going to manage it, or if we're going to do any more labs or any other type of test that needs to be done. Because when you're in a real patient scenario, you're not gonna turn around and just walk out of the room. You're gonna tell them, you know, I usually will give a patient almost like a list of differential diagnosis, you know, with these kind of symptoms and this kind of history, you know, that you've described to me. There's a couple of different things that can be going on. So we're gonna do some either lab work or some imaging, whatever I think we need, you know, to see, you know, which one it actually is. Because I mean, like ovarian torsion, ectopic pregnancy, and acute appendicitis can present the exact same way with the exact history. I mean, so you've got to do your labs and imaging just so you know, which path you need to go down, because they're all three managed very differently. But that way the patient knows what you're thinking, you know, they have an idea then of what could be going on. Sometimes it makes them really upset and nervous, sometimes it doesn't. But I'm one of those people, I'd rather them know than for me to come back in a room and go, well, this is what you have, and they didn't even know what I was thinking to begin with. Does that make sense?
Mm-hmm. And then we need to do like a write-up and everything and email it to you.
You're actually gonna give it back to Miss Riggs,
Okay.
because I've actually got it all typed out, and I'm gonna take all of the stuff with the cardiopulmonary and stuff, I'm just gonna black that out, because I've already got them printed. So she'll give you your chart, and then that way you can just fill in the blanks. And I got very specific on the physical exam part: rashes, lumps, sores, itching, dryness, changes in color, changes in the hair or nails, and changes in size or colors of molds. So that way, you shouldn't miss any of the key points. Okay? But like I said, it's important to learn process and identification, but at the same time, you're not ever gonna have to just go in blind and, you know, start pulling things out of the air. You know, I want you to learn how to do it, and I figure we're gonna start easier, and then each semester and with each type of scenarios we do as far as our practicals, they'll get a little bit harder. So that by the time you finish patient assessment 3 next spring, you're ready to hit the ground running for clinicals. But I think now's the time to really think about what you're doing and how you're doing it, what you're seeing, and then once you get into your clinicals, you can even think back to some of these scenarios, believe it or not, and think, I remember seeing that, or I remember doing that. And you guys have got your,
Do we need to finish that and turn in, like, that
yeah,
on Monday?
once you,
Once we.
and be here like 20 minutes before your scheduled time, and like I said, I'll post that as soon as we finish in here. And that way, if these groups are turning over faster, then the next group can, actually, I think there's only one group, no, 2 groups. There's 2 groups that all 4 rooms are being used, and then the group that's going from 11 to 12 uses 2 rooms. So, but I'll get those posted. And then there's another thing, Jacob, if you wanna sit